Welcome to This Week in Obstetrics and Gynecology. This week we're covering 9 notable papers spanning prenatal interventions and advanced screening, modern approaches to labor management and reproductive safety, and long-term therapeutic outcomes in gynecologic oncology and urogynecology. Let's dive in. We begin this week with major updates in prenatal intervention and diagnostic imaging, highlighted by the highly anticipated RAFT clinical trial. This prospective non-randomized trial conducted across 13 United States fetal therapy centers evaluated the efficacy of serial amnioinfusions initiated before 26 weeks gestation to mitigate lethal pulmonary hypoplasia in cases of anhydramnios due to fetal kidney failure. Out of 32 participants, 91% had a live birth, with a median gestational age at delivery of 34 weeks and 1 day, though all participants delivered preterm before 37 weeks. The primary endpoint, neonatal survival for 14 days or longer with dialysis access placement, was achieved in roughly 2/3 of the live-born neonates. Survival was strongly associated with receiving a higher number of amnioinfusions, a longer interval from the first amnioinfusion to preterm pre-labor rupture of membranes, a gestational age greater than 32 weeks, and a higher birth weight. While maternal complications were common, including preterm pre-labor rupture of membranes in 56% of patients, and chorioamniotic separation in 29%, no unexpected serious maternal adverse events occurred. Impressively, nearly half of the live-born infants survived to hospital discharge, and among those surviving to date, 64% have successfully undergone kidney transplantation between 2 and 5 years of age. These findings suggest that serial amnioinfusions offer a viable mechanistic pathway to mitigate lethal pulmonary hypoplasia, transforming a historically fatal diagnosis into a treatable condition, albeit one still associated with significant neonatal morbidity. Transitioning from prenatal intervention to first trimester screening, a cost-effectiveness analysis, or FMF screening strategy, to the NICE guidelines in the United Kingdom. Simulating a cohort of 10,000 singleton pregnancies, the study evaluated the FMF multi-marker approach, which combines maternal factors, mean arterial pressure, uterine artery pulsatility index, and placental growth factor, assuming high-risk patients receive 150 mg of aspirin daily. The FMF strategy proved to be highly cost-effective, demonstrating a cost saving of over £3,000 and a gain of nearly 1 quality-adjusted life year per 10,000 patients compared to risk factor-based NICE screening. This multi-marker strategy was dominant across various preeclampsia incidences and aspirin adherence rates, underscoring the clinical and economic value of implementing comprehensive first trimester screening. To achieve the high-quality imaging necessary for such advanced prenatal assessments, a new clinical guide in ultrasound in obstetrics and gynecology introduces the DASI technique for fetal cardiac image optimization. Recognizing that misdiagnoses of congenital heart disease are frequently linked to suboptimal image acquisition, the authors outline a structured 4-step approach. DASI stands for depth, adjusting depth and focal zone placement; angle, optimizing sector width and the angle of insonation; zoom, ensuring appropriate magnification; and enhancement, fine-tuning system settings. This systematic framework provides clinicians with a practical, reproducible method to optimize spatial and temporal resolution on both two-dimensional grayscale imaging and color Doppler, directly addressing the technical barriers that often compromise routine screening. Next, we turn to labor management, reproductive technologies, and maternal safety. Writing in BJOG, researchers in Italy evaluated the long-term impact of a structured, multifaceted caesarean reduction strategy in a high-complexity tertiary center over a 10-year period involving more than 28,000 deliveries. The intervention, introduced in 2014, incorporated standardized protocols, continuous staff training, Robson 10 group classification audits, revised dystocia criteria, updated induction methods, intrapartum ultrasound, a dedicated VBAC clinic, and physiology-based cardiotocography interpretation. Segmented regression analysis identified 2016 as a clear turning point. Prior to 2016, the caesarean delivery rate was stable, but afterward, it showed a significant and sustained annual decline of over 1.6 percentage points. Crucially, this reduction was achieved without any adverse impact on neonatal outcomes, such as low arterial cord pH or major maternal morbidity, although a modest increase in postpartum hemorrhage was noted. This study demonstrates that a highly disciplined multidisciplinary approach can safely and permanently lower caesarean delivery rates. For patients who conceive via assisted reproductive technologies, or ART, long-term offspring health is an area of ongoing interest. A systematic review published in Fertility and Sterility synthesized data from 55 studies tracking ART-conceived offspring from fetal life to adulthood. The review found that while ART-conceived offspring frequently exhibit subtle cardiovascular differences, such as mild cardiac remodeling, modest blood pressure elevations, and early endothelial dysfunction from fetal life through adolescence, these variations are generally mild and remain within normal physiological ranges. By adulthood, most cardiometabolic parameters are comparable to those of naturally conceived peers. Furthermore, similar profiles were observed in the offspring of subfertile parents who conceived without ART, suggesting that parental subfertility, rather than the technology itself, plays a major role in these developmental adaptations. In a related look at early pregnancy safety, a systematic review and meta-analysis in Obstetrics and Gynecology addressed the safety of maternal exposure to glucagon-like peptide 1 receptor agonists, or GLP-1RAs, during the peri-fertilization period and early gestation. Analyzing 8 studies representing over 186,000 pregnancies, including more than 47,000 exposed, the researchers found no statistically significant differences in the odds of preterm birth, preeclampsia, or gestational hypertensive disorders. Interestingly, sensitivity analyses suggested that peri-fertilization exposure might even have a protective effect against developing gestational diabetes, reducing the odds by nearly 20%. While study quality was variable, these findings provide reassuring initial data for clinicians counseling patients who experience unplanned pregnancies while taking these increasingly common medications. In our final thematic section, we review key updates in gynecologic surgery and oncology, beginning with a long-term follow-up study in BJOG, comparing retropubic and transobturator midurethral slings for primary stress urinary incontinence. Evaluating a cohort of over 1,800 patients with a median follow-up of 11 years, the study found that both procedures maintain a low overall failure rate. However, patients who underwent transobturator sling placement had a roughly doubled risk of requiring reoperation for recurrent stress urinary incontinence compared to those who received retropubic slings. This risk was particularly high when the transobturator sling was combined with a concurrent prolapse repair, which showed a nearly 4-fold increased risk of failure in matched analyses. Conversely, retropubic slings were associated with a significantly higher risk of requiring reoperation for postoperative urinary retention, with matched analyses showing an 8-fold increase in risk compared to the transobturator group. These findings highlight a critical clinical trade-off. Transobturator slings offer a lower risk of urinary retention but a higher long-term failure rate, especially during concomitant prolapse surgery. Moving to medical management of benign uterine diseases and endometrial hyperplasia, a retrospective cohort study in gynecologic oncology evaluated the potential benefits of combining sodium glucose cotransporter 2 inhibitors, or SGLT2 inhibitors, with progestin therapy. Utilizing the TriNetX clinical database, researchers matched over 7,000 patients receiving both therapies against an equal number receiving progestin alone. Over a 2-year follow-up, patients receiving the combination therapy experienced a 57% lower risk of incident endometrial cancer and a 49% lower risk of subsequent hysterectomy compared to those on progestin alone. This suggests a potential synergistic protective effect that warrants prospective clinical trials. Lastly, we look at patient-reported quality of life in advanced ovarian cancer. The final analysis of the PRIMA trial evaluated quality of life among patients receiving first-line maintenance therapy with the PARP inhibitor niraparib. Reassuringly, the long-term data confirmed that niraparib maintenance did not negatively affect overall health-related quality of life compared to placebo, with early gastrointestinal side effects resolving over time. In contrast, disease progression was associated with a severe, immediate, and sustained deterioration in quality of life, marked by worsening fatigue, dyspnea, pain, and appetite loss across all patient subgroups. These findings emphasize that the clinical benefit of extending progression-free survival with maintenance therapy is directly linked to preserving the patient's daily quality of life. If you only have time for one paper this week, make it the RAFT clinical trial. This landmark study provides the first multi-center prospective evidence that serial amnioinfusions can successfully reverse lethal pulmonary hypoplasia in cases of early-onset renal anhydramnios, offering a viable pathway to survival and eventual kidney transplantation for a condition that was previously considered universally fatal. Here are the key takeaways from this week in obstetrics and gynecology. First, Serial amnioinfusions initiated before 26 weeks for renal anhydramnios can successfully mitigate lethal pulmonary hypoplasia, yielding a nearly 66% survival rate to 14 days with dialysis access, though maternal complications like preterm prelabor rupture of membranes are common. Second, first trimester preeclampsia screening using the multi-marker fetal medicine foundation strategy is highly cost-effective compared to traditional risk factor screening in the United Kingdom, supporting its widespread clinical adoption. Third, long-term follow-up of midurethral slings shows that transobturator slings have a higher rate of reoperation for recurrent incontinence, especially when combined with prolapse repair, while retropubic slings carry a higher risk of intervention for urinary retention. Fourth, perifertilization exposure to GLP-1 receptor agonists does not appear to increase the risk of adverse maternal pregnancy outcomes, providing reassurance for patients with unplanned pregnancies. And finally, the combination of SGLT2 inhibitors and progestins is associated with a significantly reduced risk of endometrial cancer and hysterectomy in patients with benign uterine diseases or hyperplasia. That's your roundup for this week in obstetrics and gynecology. The full transcript and references are available on the episode page in your Audio Scholar library. This is an AI-curated summary. For clinical decisions, always consult primary sources and current guidelines. See you next week. If this weekly briefing is useful, follow the show in your podcast app so new episodes arrive automatically. And for audio briefings on your own clinical questions and papers, visit audioscholar.cc. This is an automated summary generated by artificial intelligence, which can make mistakes. Always review the original source materials.